Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. Over the past week, we've seen the number of cases more or less stay the same, but we're still seeing some outbreaks in particular settings, particularly indoors in indoor workplaces. I'm going to hand over to Simon Chatt now, who will go through the data in a bit more detail.
This is an overview of the latest national and local data on COVID-19 as of Wednesday, the 31st of March. We start with the national picture. Cases continue to fall nationally, but are still above the levels seen last summer and early autumn. The number of tests conducted remains high and deaths continue to fall. Now for the local picture. In Devon, for the latest available week, there are 135 COVID-19 cases and 2 deaths, with rates of both below the national average. Case rates are slightly higher in East and Mid Devon. Cases of COVID-19 have remained relatively stable over the last week in Devon. Case rates are currently highest in those aged 20 to 39. The data in the summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. With the easing of the restrictions and a nice long Easter weekend to look forward to, it's obviously natural that people are going to meet up with friends and family, maybe many of whom they haven't seen for a long time. But please remember, while you can meet up, 2 households or maximum 6, it's only outdoors, not indoors. So that's in a garden, a park, at a beach, for example. And if you choose to meet up, please continue to stick to the public health guidance. Keep 2 meters apart, wash your hands regularly. And if you're having a barbecue at the weekend outside, then please don't share cutlery and try and avoid using the bathroom. We know the virus transmits really well indoors, so staying outside, keeping 2 meters apart is absolutely crucial to try and reduce the transmission. I'd now like to hand over to Dr. Paul Johnson from NHS Devon CCG.
Over the past week, the South West has seen a slight fall in the number of coronavirus cases and people in hospital with the virus. The ending of the stay-at-home rule on Monday will have been welcomed by many as the first chance to see friends, family and loved ones outdoors for many months. However, it's also a critical time as inevitably people will start to mix more, which may lead to an increase in cases. So please do continue to follow the national guidelines by not socialising indoors with those outside of your household or support bubble, by only meeting outside with groups of 6 or 2 households, by getting a test and isolating as soon as possible if you have COVID-19 symptoms, and of course by remembering hands, face, space. The best way to reduce the risk of more infections, hospitalisations and sadly deaths is for people to continue to get their vaccine when they're invited, which more than 600,000 local people have done so far. We're also making good progress on second doses, which is vital to get the full protection. You will no doubt have heard that there is a significant reduction in vaccine supplies nationally during April, so no further appointments will be made available on the National Booking Service this month for first doses. However, existing appointments are not being cancelled, so if you already have an appointment over the coming weeks, whether it's for your first or second dose, you should continue to attend as planned. Second doses are due between 11 and 12 weeks after the first dose, so if your appointment is due in April, we will have enough vaccine for you and you will be contacted about it. The Easter weekend is almost upon us, which for the health service means that most GP practices will be closed for 4 days from Friday. So if you need urgent medical help in that time, I encourage you to think 111 first. You can contact 111 by phone or online at any time of day or night to get the clinical advice and care you need, which may mean you don't have to visit an emergency department unnecessarily. So our message to you, the opportunity to see family and friends outdoors again is good news and demonstrates the progress we're making. But we must continue to be careful by continuing to follow the national rules. You can still enjoy being with your friends and family, just make sure you are outside. And if you need medical help this Easter weekend, remember 111 first.